Cataracts are a very common condition of the eye and consist of some clouding of your own natural lens. And they're mostly age-related and come on very gradually. But the nice thing about them is that as a cause of poor vision, they are the most treatable and the most satisfactory to treat. The vast majority of cataracts are really age-related, but they can be present from the age of 50 upwards. Very occasionally they happen in younger people for other reasons, but that's very rare indeed. It's mostly an age-related condition and tends to get worse as we get older. The symptoms of cataracts are quite non-specific in ways. They just normally consist of some blurring and haziness of the vision, and particularly glare in bright lights, in bright sunlight. And one of the first things that people notice with cataracts is that they find difficulty driving at night because of the glare from oncoming headlights. They find that quite disturbing. There are some other symptoms of near vision tasks, and particularly reading can become difficult even in bright light. The decision as to when to have surgery is really entirely subjective, and by that I mean that it depends very much upon the age and lifestyle demands of every patient, because the visual requirements differ, say according to whether you're of working age and require very good detailed vision for a computer screen, or whether you're retired and just read headlines and maybe occasionally play golf, and your visual requirements will be very different. The procedure that's involved is the same for everybody, which is basically using ultrasound energy to dissolve the cataract and then to suck it out of the eye through a very small incision and to replace it with a folding lens implant that's injected into the eye and expands to its normal shape once it's inside the eye. Nowadays, laser is available also for treating cataracts, but that only does part of the operation. And the cumulative evidence to date is that it doesn't significantly improve the outcomes over our already established treatment methods. The nice thing about cataract surgery is that the recovery is generally very quick. In a matter of days, you will have reasonable vision after the surgery. The first couple of days can be a little bit disappointing if you're expecting miracles, because the vision is often bright and blurred because the pupil is still dilated and the eye is slightly inflamed. But that generally settles down very rapidly, and you'll be on drops for about a month after surgery, but the vision improving significantly over the first few days.